After helping to treat 2 Ebola patients who returned to Spain with the virus and who have since died. There are also new developments for the Ebola patient in Texas and now Nebraska. In Dallas, Thomas Eric Duncan is in critical condition. In a moment, you're going to hear from the woman he traveled from Liberia to see, Louise, who is still in quarantine, the woman he stayed with, along with her son and 2 nephews. She's scared, she's worried, and she's begging for help. Tonight, a freelance cameraman who contracted Ebola while covering the outbreak in West Africa is in isolation in Nebraska Medical Center. He arrived for treatment just today. Also today, President Obama said he considers Ebola a top national security priority and an issue of safety. He says the chances of an epidemic in the United States are extraordinarily low if everyone does what they're supposed to do.
This is an extraordinarily virulent disease when you don't follow the protocols. And so the key here is just to make sure that each step along the way, whether it's a hospital, admissions desk, whether it is the doctors, the nurses, public health officials, that everybody has the right information. If they have the right information and they are following those protocols, then this is something that we're going to be able to make sure does not have the kind of impact here in the United States that a lot of people are worried about.
Well, if you've been following the case of Thomas Duncan at all, you're likely aware there's been a series of serious breakdowns in communication, to say the least, along the way. In fact, the hospital that originally blamed a glitch in their electronic health records for the reason they failed to admit Mr. Duncan, even though he was showing the symptoms of Ebola and had traveled from Liberia, that hospital finally admitted over the weekend all the records were available and they should have admitted Mr. Duncan immediately when he first came to that hospital. That was one of a series of missteps that has left many wondering if this country could handle even the bigger outbreak. I spoke with CDC Director Thomas Frieden just a short time ago. Dr. Frieden, first, can you tell us how Thomas Eric Duncan is doing? Is he still in critical condition?
I'm afraid the patient in Dallas is still critically ill, and we're really hoping for his recovery. That's very much on our minds these days.
A federal official confirmed to CNN that Duncan is receiving an experimental drug, and Duncan's nephew, who's also getting regular updates from the hospital, identified it as a drug called brincidofovir. Is that true?
The actual treatment of the patient, that's really up to the patient's family, and the hospital to release. I will say that we know that the medicines that have been used before have not been used here. There are other medicines like brincidofovir that have been shown some promise in a test tube. Whether they would help or not, we don't know, but certainly we would want everything possible done to try to ensure his recovery.
The medicines before that have been used, which you referenced, ZMapp, which was used on the 2 American missionaries, is there, just to confirm, is there no more of that currently available?
That's my understanding. There's no more ZMapp, and it takes a long time to make. The other one, Tecmira, is difficult to use, and in critically ill patients may not be safe to use.
On Thursday, I spoke to a woman, Louise, who was the woman who was at whose apartment Thomas Duncan was staying at, and also took him to the hospital. I also spoke to her earlier as well. We're playing some of that in our broadcast tonight. As you may know, I mean, she says that the towels that he used were still in the apartment when I talked to her last week. The sheets were still on the bed, and no one had really told her exactly what to do with it. The fact that they were left there days after it had been announced that he had Ebola, why wasn't that more of a priority to try to clean up that apartment?
I think there are things that we're learning from this case. We know that the hospital didn't identify Ebola the first time he went in. It took far too long to get all of the things together to clean up the apartment and ultimately get the family out, as that was the decision that was made locally. These are things that we'll look at for future responses. But I think you have to look at the bottom line here of how we stop Ebola from spreading. That bottom line is to find every person who was exposed to the index patient, make sure that they are tracked for 21 days after exposure, and the moment they develop fever or other symptoms, get them promptly isolated so that they don't spread it. That's how we stop Ebola. That's how you break the chain of transmission. That's the bottom line and the most important thing to focus on. And the folks in Texas are doing a terrific job with that. They've identified 10 likely and 38 possible contacts, and every single one of them is without fever, without symptoms, and is being checked daily. That's how we've stopped every Ebola outbreak until now, and that's what we're trying to ramp up in Africa as well, so we can bring that under control and make us all safer.